Hello, everyone, and welcome. My name is Neeraj Mathur, and I'm the founder and CEO of Savings Oak, a modern digital health savings account provider. Based here in Silicon Valley, we are bringing our years of experience to build the next generation HSA platform to increase participation and utilization of this incredible and unique benefit health savings accounts that helps employers and employees. I am delighted today to be the moderator of this session focused on health savings accounts for small and mid sized businesses, which employ nearly half of our country's workforce. I would like to extend a warm welcome to Aaron Papworth, founder and CEO of Navit. And I would also like to extend a warm welcome to Mark Siebold, a veteran in the HSA industry. And please also say hello to Mimi Mortazai, my partner in crime and teammate who runs marketing here at Savings Oak. With that, Aaron, over to you. Can you tell us a little bit about yourself and your experience so far with Navit?
Yes, thank you. My name is Erin. I'm the CEO and co-founder of Navit. Navit is a financial tool that really focuses on the behavioral science and the emotional triggers around finances, helps people coach them into habits, helps them kind of set up their financial foundation. And our mission is really to move people on the financial health continuum into bigger wealth generating conversations. So I have a behavioral science background. I spent a long time working overseas, running behavioral health programs. And I really came back to the United States empowered and feeling very impassioned that preventative medicine is really getting young earners in their 20s to really understand how the financial system works, because that allows them to really be able to build wealth over time. And there's just an epidemic in this country of people with low financial literacy rates and really complicated financial questions that we have kind of unprecedented between the 2008 crisis and COVID now and all the other things that have happened in the last 15 years. So that's a little bit of my background.
Yeah, well, thank you. Well, and I'm sure there's so much in there from a behavioral science and cognitive perspective that we'll talk about around education, something close to our heart. Education, that is amazing sort of segue to you, Mark, because that is something huge from a financial literacy standpoint and independence standpoint that you talk a lot about. Can you introduce yourselves to us, please?
Yeah, absolutely. I'm Mark Siebold. I've been in the HSA industry for, 10, 11 years now, back to 2012. Before that, I was in the 401k space. So a lot of benefits experience, a lot of education and communications experience. I mostly was in marketing, product, and sales roles during my time in financial services. Great to be here with all of you. For me, it's a bit of a Wayne's World moment. You know, I'm not worthy sort of thing, but certainly appreciate the time to talk about something that I'm incredibly passionate about. And when it comes to health savings accounts, we get excited about them because we think they're the solution or part of the solution for two problems in this country. The first of which is the rising cost of healthcare, and they help hopefully make people better consumers of healthcare. But the second that we don't talk about nearly enough, I don't think, is we have this retirement savings gap, this problem in this country where people are not saving enough for their retirement years, especially for healthcare. We've heard numbers in the range of $200,000 to $400,000, up to $600,000 I've seen needed for healthcare and retirement. People don't have enough money and they're not saving enough. HSAs are the perfect solution or part of the solution to close that retirement savings gap. So thank you.
Thank you for sharing. Mimi, quick introduction on you.
So I run marketing for Savings Oak, and my intro was to HSAs were through Savings Oak, and I am a big believer in alternative medicine like acupuncture and functional medicine, and so I love the way that kind of comes in through getting a little bit of a discount in through health savings accounts. And my background is I have about 7 to 10 years of background in content and marketing and through educational publishing and through startups.
Awesome. Thanks. Thank you so much. I'm so excited for speaking with all of you about some of these things. But first, coming back to you, Aaron, as a CEO, can you share some insights on how as for a company, as a small, mid-sized business today, and definitely a very large company in the future very soon. How do you strategize about benefits for your employees? How do you go about that thinking process?
Yes, it's been very interesting. We were already a remote team before COVID, but of course, COVID has really exacerbated the way you think about creating an organizational culture and how you support your team members in a remote setting and provide those benefits. We really look at a couple things. Since it's a remote setting, we look at trying to make our employees as connected as possible and feel like they are really part of something that's bigger than just them in their office alone and isolated. So we really focus on trying to connect people. And from a benefits perspective, you really see people want the flexibility. They want to be able to live and work where they want it to feel like they have freedom, but also, with responsibility. So we really look at benefits from a perspective of how can we put more money in their accounts, in their pockets, because then that's why we love HSAs. How do we get them a comfortable working environment, and how do we connect them? Those are kind of the three big things that we look at.
Yeah, that's thank you for sharing that. Actually, that brings me to you, Mark. You having worked over the decades, I should say, at least a couple now, with so many small, mid-sized business owners during your career, what challenge do they have when it comes to employee benefits? And what are a couple of things that they should be looking at to overcome those, particularly in this post-COVID era, where a stocked refrigerator with 7 types of waters isn't gonna cut it?
Yeah, that's a good question, and Erin knows even better than I because she, struggles with some of those challenges. But what I've seen talking to many, many small and mid-sized businesses, not just over the last couple of years, but to your point, going back a couple of decades, is it's hard to find solutions. It's hard to find service providers that are going to help them meet their challenges because a lot of the providers are focused on the bigger companies. So that's one point. Seems to be a void there. But specifically, challenges when it comes to benefits and health savings accounts is getting the education, getting the communication in the hands of the people who need it, the employees, in a way that they can consume and then take action on it so they can increase participation. Again, specifically in HSA plans, we're seeing fairly lower than we want participation in those plans. So people will open up a high deductible healthcare plan or a lower premium plan, as we like to call it, but not open the HSA account. And a lot of times it's because the HR teams are strapped. They don't have enough people, enough time to put together specific communication strategies, or may not understand the products well enough. That's a big part of it too, to put the right knowledge in front of the right people so that they take control of their benefit selection and make the selections that are in the best interest of them and their family. So that's a biggie. And that's where I come in, and I hope I can help employers solve some of those problems.
No, that's awesome. Actually, that brings me to the next point about you talked about, lack of awareness sometimes, also paucity of time, not having enough time to get all this. We actually jam. Most times people are asked to think about their benefits either at the time of enrollment, which is about 3 weeks typically, or at the time when they're joining a new job, which is, I have to take on this job. I'll deal with this thing later. And last minute, you're rushing to get these things done. This brings me to a question to you, Erin, from a standpoint of trends and understanding what's out there.
Yes.
When you think about having this conversation of benefits, I mean, as a CEO, you're talking with your CFO, benefits person, payroll, HR person who's leader. How do those things move forward that you've seen from your experience, and what are some of the trends you are seeing when those conversations come up? How do you optimize those?
Absolutely. Yeah, it's a great question. I think previously, as Mark said, there was this kind of feeling in the tech world of, oh, you need to give them as many crazy perks as possible, especially to attract young people, right? You have to give them the free drinks at the bar and, the pool table and the lunchroom and these things. But I think really in the last 2 years, and we play in this world too, in the financial well-being world, you see really 2 key areas being the focus. One is wealth, like really, and which is where HSAs come into. Like, how do we get more money in the pockets of people? How do we create jobs that are sustainable and some that actually feed people?
You're good.
And then, sorry, you disappeared. Oh, okay. And then where else do you And the second part is health and well-being. And so trying to ensure that you're creating an environment where they can sustain themselves, their wealth, and they're generating enough capital to live healthily. And then, of course, on the second side, the health and well-being, I think is a really key part, especially in the last 2 years with the kind of mental health and struggles that have occurred, that you really see that lack of connection and the kind of need for well-being. So I think HSAs are actually kind of a perfect bridge between both of them, because you create this environment from a health perspective where, of course, everyone needs to choose their healthcare plan. If you have the ability to educate, I really do think that's one of the kind of key factors of reduced uptake of services in HSA. But it's a health plan, so you're both talking about how do you cover things that your family needs, or as you said, the alternative medicine that's very popular and people are demanding now. And then how do you also think about it as an investment vehicle, and how do you think about it as generating wealth for yourself and your family? I think those two things are really the future, and the rest, we can do away with the scooters around the office and the ping pong table, right? This is the future.
Yep. No, I agree. Actually, just a quick housekeeping question, since we are broadcasting on 3 different social media streams live. To our audience, please keep asking or sending those questions. We are keeping track of them, and we'll ask Aaron and Mark questions. A question that's come up, Mark, is, hey, can you talk a little bit about health savings accounts for those who may not be fully aware of what HSAs are, and a high-level overview of how they work, and what type of small, mid-sized business should be considering them as a company-sponsored offering?
Yeah, and that's a really important place to start, because unfortunately, I don't think that the basics are even out there within a lot of small and mid-sized businesses yet. HSAs are still relatively new. They started in 2004, so they haven't been around nearly as long as FSA, flexible spending accounts, or 401k plans. So that's part of our job, is just to get the word out and educate employers and their employees. So a health savings account, and I like to compare it to the flexible spending account, because more people understand the FSA, I think, than the HSA. The health savings, with savings being the important word, is a savings account that people can use for medical expenses. One of the prerequisites to having an HSA is you have to have a high deductible healthcare plan, or as we like to call it, a lower premium plan, or an HSA eligible plan. You'll see it called sometimes. You have to have that plan in order to have an HSA, at least to fund it. So that's the first thing. The second thing is really related to the tax benefits, and that's where you get the huge benefit of having an HSA and funding it every year. Is money goes into the account pre-tax, so it's free of federal and state tax. It's also free of FICA tax. That's another little tidbit that not a lot of people understand, is you don't pay FICA tax on HSA contributions like you do for 401k contributions. That's for the employer and the employee. And then money grows tax deferred. So if you would invest it or gain interest on the deposits, that's tax deferred, no taxes there. And when the money comes out of the HSA account, hopefully people are saving it for retirement, because there's no use it or lose it clause like you have with the FSA. All that tax deferred growth comes out tax free if used for qualified medical expenses. When you reach age 65 and you're on Medicare, if you take money out of the account for non-medical expenses, you're not going to pay a penalty, and you're going to be taxed the same as you would be taxed on a 401k distribution. So when we think about 401ks and HSAs side by side, both are really important tools for people to use for retirement. We want more people to think about the HSA specifically for medical expenses in retirement, because again, the money's coming out completely tax-free if used for that purpose. The 401k, you're going to lose 20, 30 or more % in taxes when you take that withdrawal.
Yeah. I really love that point. Sorry, just to ask a question, Mark. I've heard numbers like people after the age of 65, they spend something like $10,000 to $30,000 a year in medical expenses. Is that around that accurate?
It is, yeah. And when you multiply that out over all the years of retirement, 10, 15, 20 or more years, we've seen numbers, as I mentioned earlier, $200,000, $300,000, $600,000 needed for an average couple in retirement, just for medical expenses. So it's just it's a huge number that most people aren't prepared for, unfortunately.
Yeah,
oh.
That's a good point. And I think up until about 2019, early 2020, before COVID, That number used to be $300,000 for an average couple from retire in the retirement to be able spending. In the last 2 years alone, that number has now gone up to 320,000. So we talk about pandemic. From our perspective, we're looking at the pandemic of the healthcare costs is actually here, and we're not prepared for it. And in that way, Aaron, it makes sense from your perspective, as you do run an organization and you're thinking about it, how are you looking, or what worries you or concerns you the most about these ever increasing healthcare costs? Because you want to do the right thing for the employees always. But there's also this sort of a strike a balance, making sure the costs are going high. Are they getting the right benefits? Are they utilizing them in the right way?
Absolutely. Yes. I mean, as a small business, you're always looking at cost and how it's a cost benefit analysis. Every time you look at a benefit, you're trying to attract good talent. You're trying to keep and retain people that are excellent workers and believe in you and work for you. But it's always the rising cost of healthcare is something that I think is not sustainable in our country, both for the employee and the small businesses and the employer, but also for the consumer and the employee. So for me, what we're looking at is always how can we protect our people as much as possible? What services can we get them, and how can we think of preventative medicine? Because I come from this behavioral science background, so we really look at how do we keep people healthy, and how do we provide things like well-being perks? How do we make sure? I mean, we talk about financial well-being, but there's also health and nutrition and exercise and all the other things that people are interested in, but you want to provide and support from an employer standpoint. And then, of course, at the end of the day, we're looking at how do we create an environment that that allows them to access that in a healthy way. So telemedicine is something that I really believe in as an important asset, especially in the mental health space, and being able to access and primary care to be able to access that in a lot of different ways. So for me, long-term preventative medicine and really focusing on ensuring people are healthy so that by the time they get to be in retirement, they're not having to spend $300,000 over the course of their. There's inevitable cost as you get older and health, but trying to kind of focus on the preventative medicine to me is the most important.
Yeah, that's an important point. I actually liked how you put it. Maybe that's so when we think about healthcare benefits, a lot of the conversations have always been about costs associated with it, and they're rising. There's a recent study about an average small business is looking at about up to $2,000 per employee increase every year over year from their healthcare benefit standpoint. But changing the narrative, as you talked about, let's talk a little more on the preventive side. We're coming, and I want to ask this question to you, Mark, is maybe there is a narrative change from a behavior or cognitive perspective, saying looking at HSAs not just as a healthcare benefit because it gets commingled, but also as a very important vehicle for a retirement funding, and being able to look at as a long-term investment vehicle complementary to 401ks. This is not an either or situation, but you need to do both. Whereas a benefit that will allow you to be able to pay for healthcare expenses is specifically used for that. As Aaron pointed out, as we grow older, there are going to be needs that we'll have to tackle. We don't have to come it out of 401k. What's your take on that, Mark? How could companies, or should companies, be changing the narrative from just being a healthcare related benefit HSAs, but also pushing out or understanding, to your point earlier about awareness, of looking at HSAs as a complementary to a 401k retirement vehicle?
Yeah, and that's the paradigm shift we're trying to make happen, is to change the view of HSAs as a spending vehicle to a retirement savings account. And it goes back to a point I attempted to make a little bit earlier about HSAs and why they came to fruition. One of the initial guiding elements of the HSA was that if you have people choosing a high deductible health plan or higher deductible health plan and saving their own money for medical expenses, by the nature of that relationship with the health plan, they're going to make better decisions, or at least put more thought into the medical expenses or medical services that they're consuming. They're going to think about that test. Do I really need it? Or if I, have an MRI or need an MRI, do I have to have it at the hospital, or can I get it, at a clinic somewhere where it's cheaper? that was the original idea behind it. So if we keep the focus on that, which I think is a really good concept, to Aaron's point, the best way to prevent medical expenses is to live a healthy lifestyle and do the things originally or initially that prevent you having to have those expenses in the future. So if we put the focus there, and then secondarily, the HSA as a retirement vehicle, so save as much as you can, think about it alongside your 401k for medical expenses that will inevitably rise in retirement. That's a good story, and it makes a lot of sense when you put all those pieces together. And oh, by the way, it helps people focus on living a healthy lifestyle, which is good for everyone, including those individuals that are involved with the health plan and the HSA account.
Remind
Yeah,
me, I'm sorry, I have another question. Remind me, is there interest? I know it's really a tax deferred vehicle, and I see the incredible economic benefit, but is there any interest on HSAs?
Yeah, good question. So there's two main components to a health savings account in terms of when money goes into it. One is a cash account. So there is interest earned on that cash deposit. More importantly, and the message that we're trying to get in the marketplace is you can move that money into investments and use ETFs and stocks and mutual funds to grow those funds over time. But yes, there's two components to it, the cash and then the investments.
Which is pretty phenomenal, right? I mean, you can it's tax deferred, and then you also get the benefit of possible market growth over time. So someone could potentially leave their career with 200, 300,000 in an HSA if they haven't touched it over time. Is that possible?
That's correct.
Yeah, it's incredible.
Yep.
Yeah, and it's particularly interesting, Aaron, if we think about where Navit is coming from, financial awareness, one place for people to be able to save a little for long term, right? When HSA comes as a benefit, it's exactly that. For millennials, two things that are extremely important is, and not just millennials, but for everyone, is leaving the money so you're going to leave some money as cash to be able to pay for deductibles or what have you that you need to take care of year over year. But if you can pay some of it out of pocket, and the other concept of shoeboxing comes in, since the day you establish an HSA to the time you actually, you can have the money invested and it grows in the market in the long run. We know in the 10, 15, 20-year markets always actually end up from a growth standpoint. History tells us from that perspective, right? And you can walk away with quite a decent amount of kitty that can be focused just for healthcare.
Yeah.
So
it's really
fascinating. It really is. And I'm excited about it. Look, you can see me smiling and I get all passionate about it because I think it is one of those best kept secrets that we as a society need to bring out more for everyone in the US to be kind of taking a look at, saying this is doable for everyone, not just for high earners, but even for those people who can put in $20, $50, $100 a paycheck or something like that. And over a period of compounding actually kicks in and helps people have that healthcare cost taken care of. That brings me to the next question, Aaron, for you is like, in terms of HSA's personal experience or through other people, what has been your experience if you've interacted with your employees who may have had or in the past, and how much do they know? And have you had conversations as a company or outside in your sphere of influence?
Yes, absolutely. Well, I've had experience as an employee in my, previous life for sure. I believe I worked at two places, especially Johns Hopkins University, that had an HSA. I think from the industry that you're trying to serve, we are such a small business that being able to provide these things has historically been a little bit outside the cost ability of early stage startups and kind of venture backed tech companies that are trying to optimize their dollars as much as possible. But in the long run, it's something that we talk about a lot, and we do education. Clearly, there are different types of, I have experts that talk about this. It's not my world of expertise, but it's definitely the conversations are always from our perspective about financial well-being, right? So HSA is an incredible opportunity if people have the option to think about how they can plan for the future, but without trying to scare them. I think one of the things in the United States we have is this like fear mongering, that we're all going to be broke, Social Security is gone, and we're all in trouble for when we're old, right? And I think the conversation for us is a little bit more about, okay, what's the practicality of this? An average family spends how many dollars a year on healthcare costs, right? If it's between 5 to 10,000, depending on if there's no extremes, right? So if you have that covered in an HSA that's already pre-tax, you have this incredible opportunity to cover those costs instead of, being always out of pocket. And then over time, as you said, grow it. So I think, we come at it as a small business, it's all about cost and can we provide it? It's definitely a priority, but can we afford it? And then from an employee standpoint, it's about education. So if people have had HSAs in the past, we have a lot of people talking to our financial coaches about, how to optimize it and how do you use it and how do you plan for it? And can you use it after you leave the employer and all those things? I think there are lots of questions around it, and education is key. Even this conversation is a powerful vehicle to educate.
Yeah, no, it's a great point. And I actually want to tack on to that, come to you, Mark, with that excellent question. Aaron talked about, small, mid-sized businesses, very cost aware, also startups that are venture backed, but early on, they're like, well, can we afford this? Can you talk from a perspective of, what are some of the benefits of the HSA program for this particular target segment? Because that's where Savings Oak is coming and wanting to change the narrative that it should not be that expensive. It should be manageable for these organizations to have the same level of offering from HSA that the other larger companies have. So can you talk about tax benefits and how it could benefit small, mid-sized companies, HSAs?
Yeah, good question. And I'd like to ask Erin a couple of questions after this too about how she communicates with people and what she's seen work with those folks, with her employees. To your point, the biggest thing is what we call FICA tax or payroll tax or Medicare tax, which I mentioned is not HSA contributions, whether the employer makes them or the employee makes them, are exempt from that tax, unlike 401k contributions. So when you're thinking about rolling out an HSA alongside your high deductible healthcare plan, the more you can educate people and the more you can design the plan in a way that encourages participation and contributions, the more money the company is going to save in the way of FICA taxes. So doing things like a match is a brilliant way to get people to come into the plan with their own money, their own payroll contributions. Just like the 401k, we've seen that work very well with 401k plans. So if you can put in a match, if the company can afford it, that's a biggie. I've seen some companies even move some of their match from the 401k to the HSA to encourage savings specifically for healthcare. So that's a biggie. Anything you can do to increase the participation, the knowledge of your employees to put more money in the account is going to benefit the employee, obviously, because they're saving more, but it's also going to benefit the employer in terms of those FICA tax savings, which if you're a smaller company and you only have a couple of people, it's not a huge dollar amount, obviously, in tax savings. But as you grow and you add more people and those contributions start to mount between all of your employees, then you're looking at substantial savings for the company, which will far outweigh any expenses that you have to actually administer the HSA program.
Cool. Thanks. Education and training. Go ahead. This is a good way to ask how is Aaron kind of looking at doing some of that adoption and utilization promotion?
Yeah, and even from your past experience, Aaron, what have you seen work in terms of communication? There's so many different types of people, learning styles, knowledge levels when it comes to benefits. Have you done anything that you've seen was more successful than other ways of communicating over the years?
Yes, absolutely. Yeah, thank you for the question. It makes me happy. It's my happy place. Where I think there is a missed opportunity in the HR world, which I understand, capacity is low. There are always small teams, but it's also from the administrator's perspective is personalized information. So if you can get people's data or they share with you, or you can access that through, even healthcare, providers, like how much did an individual spend last year on healthcare? Because I think then you can kind of coach and explain how the HSA works in a very tangible and practical way for their life. I think one of the big problems is people don't they don't have good recollection often of what they spent over. I mean, none of us do, right? Can you really tell me how much you spent on groceries the last year? Unless you're a very detail-oriented budgeteer, which I have a lot of respect for. It's really hard. You can estimate, but you don't know these kind of major ticket items that you have on a monthly or even like yearly basis. So if you're able to say, hey, look, it looks like you spent around $4,000 on healthcare last year. Think of moving forward, if we estimate, okay, you're going to spend about that 3,000 to 4,000 a year in the future, here's how an HSA would help you with that. I think that becomes a much more interesting conversation, because one of the biggest problems with financial education is that it's always kind of intangible. It's these kind of high level 401k match, those are important, but like, how does that actually affect me as an individual? Do I have a match? Do I have 2%, 1%? How much is 1% of my paycheck that then would be matched by the employer, right? Like, then how does that affect me on a monthly basis, right? And with what cash I take home. So personalization and talking about it in really tangible terms, giving even one case example. I've seen a lot of examples, you can't do that for everyone individually, but if you can show case studies of, if $4,000 came out of your pocket last year, here's how much you're putting into an HSA, here's how much your employer is matching you, here's what your cost savings would be. It's a much more tangible way to get people to understand how it affects them, and then be more interested in enrolling and seeing how long term they can participate.
That's perfect. That's awesome. So I heard two really key things. One, give people tangible examples that are personalized to their unique situation. Yeah. In the past, what I've done with folks is I'll use the what I call the Walgreens example, right? So with respect to the HSA account, if you go into Walgreens and you pay for a prescription drug, and let's say it's $50 out of pocket, that costs you $50. But if you use your HSA account for that expense, you're essentially getting a 20 to 30% discount because of the tax savings. Right. Everybody can relate to that example, right? Because they go to Walgreens, they go places to buy medications, for example. And the other thing you mentioned that I think is hugely important, because to your point, and I know I'll take some fault for this too. We tend to talk about these huge numbers that I mentioned, $600,000 or $200,000 in retirement for medical expenses, and people hear that and they shut down, right? It's like, I can't get there. There's no way I can get to that number, so I'm not even going to try. So to set realistic goals every year, I like to think of education in terms of a set of stairs. Right? You start at the bottom on the first step, and you give people a little bit of information, and then as they get more knowledgeable, more experienced, you increase the information so it's more relevant. And that first step is really, what's the value of the HSA, right? And the features and benefits. Then that next step, maybe step and a half, is let's set a realistic goal of how much money you can save, because not everybody can save the $7,000 for a family plan on an annual basis. But maybe they can save one half of the annual deductible. Maybe that's goal one, or year one goal. And then year two, assuming they didn't have to spend it, maybe they can save the full deductible. So it's that sort of education, incremental, bite-sized pieces of information that I think are going to make the most profound impact on people.
You're speaking my language. That's what we do at Navit. Another thing one of the things not to plug us, but using a budgeting app like us, or there are other ones out there, allows you to help the individual break down those costs. So there's a budget line for pharmacy, there's a budget line for healthcare. So it gives them a sense. I think that individual, to your point, that individual conversation, if you give that Walgreens example and you say, look, you spent $1,000 at Walgreens last year. Imagine you have, and is it a card, like an HSA card, right? That you use to make purchases? How does that work?
Yes.
There's multiple ways, but yeah, having a debit card is one of them.
Yeah. Okay. So that's another practical conversation, right? You have a debit card. When you're at Walgreens, you pull it out. It covers, this thing covers your Walgreens, your acupuncture, your, just making it really tangible really gives people a sense of how they would use it on a daily basis, and is powerful, and you see it over time. It's great.
Yeah. Cool. Well, this has been fascinating, and I know I can spend the whole rest of the day and probably some more of tomorrow to actually keep talking about HSAs for small and mid-sized businesses. From both of you, one last tidbit, Erin, on HSAs, for SMBs? Anything you want to add for the
I
audience?
think I think it's a great opportunity to think about it as a wellness and a retirement vehicle. I really like what you guys were saying about that. And if you can, there's actually national data about how much an average family spends on healthcare, how much they're going to need over time. You can, if you want to make those case studies for your employee to educate them for uptake of that service, then I think it's a really powerful way to help people save and really be protected in the long run.
Cool. Thanks. Mark, last comment for our audience on how this could be such a beneficial thing for them.
Yeah, first of all, thanks again for having me on, and this has been a great discussion with Aaron. It's been my pleasure. A couple really quick things. One, when it comes to HSAs, obviously we need to do a better job of educating our employees. There's a couple ways to do that. One is around plan design. So when we talk about best practices, there's a number of different things within how we design the plan to get people to participate. There's the old thinking, the field of dreams, build it and they will come sort of approach, which I don't think works most of the time. Rather, I want to find ways to go to people to bring them in by using some sort of a rewards program, for example. That's one piece of that plan design puzzle. And then also finding service providers, not just HSA providers, but other service providers that will give you tools and resources to help educate your employees to be better consumers of healthcare. And there's a number of those out there that we won't get into. And then that third bucket is education and communication, not as much the what, although it's important, but the why and the how. Those are two really important pieces as well to truly engage people. And again, get back to that main goal, our main goal, and that's to get more people participating and more people saving more in their HSA for retirement.
Awesome. Well, there's a great nuggets for everyone to take away. In the end, I just want to say thank you to both of you, Aaron, Mimi, and Mark, all three of you, for joining us today and sharing your insights and best practices around HSAs for small, mid-sized businesses. To our audience, thank you so much. We'll be responding with the questions or other mechanisms on the social media, as well as follow up through our blog on all the learnings from the folks that we've learned today. With that, thank you so much, everyone, and have a great day.
Thank you.
Bye.